All right, so I'm going over digestive, and I just wanted to focus on some of the anatomy that you should be familiar with. If you're not, the most part of the digestive system that you would need to know as far as the anatomy would be the various parts of the small and large intestines, right? Remember, your digestive system, codes for the digestive system in your 2016 book. In your 2016 book is going to start on page 261. 261. And as I go through the chapter or the different body systems, make sure you're paying attention to how I'm saying to break down the different procedures in each of the body systems so that you can familiarize yourself with the different procedures. The root operations or the procedures that are actually happening. But as far as the anatomy, back to that on this slide, you can see the stomach is the cardia, the fundus, the pylorus, and body. But usually they'll maybe ask out of for you to complete, like they'll say duodenum, jejunum, and then leave a blank, and you're to pick ileum as far as the sequence, or they may do the same thing for the large intestines and for the colon. So just make sure you understand or you know the flow of the small and large intestine, and a good place to write it would maybe be on page 262 where they have a diagram of the digestive system there. Okay, and I know some of you have also done some of your writing at the bottom of page 264. 264. As far as the digestive system over here on the right side, slide 170, you can see pancreas. Make sure you know the function of the pancreas. So if you have a pen in front of you right now, I would want you to just make sure that you write pancreas and then what its purpose is, and it's to secrete insulin into the bloodstream. Secrete insulin into the bloodstream. And the liver, we'll just know that it's the largest organ, but make sure you understand the definition of the function of the pancreas. Okay, and with the digestive system, again, ICD-10, you guys are good with ICD-10. But with the digestive system, you can always find I-10 codes from your infectious and parasitic diseases, like if you got gastroenteritis, which is inflammation, but it could be an infection source. If you're aware of what the source is, you'll code that. Also, neoplasms, because of course there's colon cancer, which is very common, and that's also something that you will need to know as far as a screening for Medicare patients. You need to know the HCPCS code for colon cancer screening for HCPCS. Okay. Chapter 11, as far as sequencing and so forth for digestive, remember that there are no coding guidelines for the digestive system. So there shouldn't be, you won't be able to refer back to coding guidelines in reference to digestive because there are none. Right, so that's not a time where you're going to have to flip back and forth. There are no coding guidelines for digestive. Okay, let's see. Moving on down to slide 173. Okay, these are just some common diagnosis for the digestive system, and make sure you pay attention to diverticular disease as far as the spelling. Okay, one is inflammation of, and the other is overproduction, losis. Okay. And remember, sometimes they'll have foreign body removal from the digestive system. Okay, and here they have irritable bowel syndrome. And these are just some other terms for the digestive system, some of the disorders. And then again, you have pancreatitis, inflammation of the pancreas. And whenever you're coding for your neoplasms, always make sure you're looking to see whether it's malignant or benign. And again, if you're on page 261, which is where the reference page begins, you can see how it's organized. You can see how it's organized. It's broken down starting from the mouth and all the way on page 264, the last body system or the last part of the digestive system that they address is the abdomen. So, of course, if you're coding for digestive system, you have to ask yourself what body part or what part of the digestive system. If you look on page 261, you'll see lips, tongue, the various parts of the digestive system. So you need to make sure that you are first looking for the location, and then secondly, what is getting ready to happen to that location. And if you look at all of the indentations or the way it's listed under each of the digestive parts, you'll notice there's only really 3 or 4 things going on there, right? They're either putting something in, taking something out, or performing a laparoscopic procedure, which means minimally invasive. Remember, in this particular area in the digestive system, what you need to remember when you're coding on the exam is that for digestive, you need to know if the procedure was performed openly or laparoscopically, because you know that if it's performed laparoscopically, you're going to have a totally different CPT code. Okay. And some of the indications to help you understand that it is a laparoscopic procedure, they will state that the provider used a laparoscope, or they'll say laparoscopically performed. Okay. So those are 2 indicators for you to know how the actual procedure was performed. Okay. Some of the common ones for the digestive system they have here: gastrectomy, bariatric surgery, and gastric bypass surgery. Gastrectomy is a procedure, right? So you can go straight to the index in your CPT, and you can look up gastrectomy because that's an actual terminology word, and it's an action word, so it's a procedure, and so it will be listed in the back. If you go to page 858, which is your index, you'll see that gastrectomy is listed on page 858, but then you have different types. So you would, although you know the procedure, now we're like, what type of gastrectomy, right? I'm on page 858 in the index. Then you're able to read into your question a little bit more and see the type, and it will give you the code range and tell you where you need to go. As far as bariatric and gastric surgery, those are going to start 436. So laparoscopically, I'm on page 281 right now in the CPT, page 281. And we're discussing bariatric and gastric bypass. The laparoscopic, now, just like I said before, with the digestive system, you have to be careful on whether the procedure is being performed open or laparoscopically. On page 281 is a great example of the gastric bypass, CPT code 43644. Right? 43644. The other thing, that's for the laparoscopic. As you can see, it's under the category laparoscopy. Underneath it, with that code definition, what you have to pay attention to, we know it's a laparoscopic procedure, but you also need to look for the length of the limb. So in CPT code 43644, you'll see that the limb is 150 centimeters or less, right? And if you jump down about 2 little notations, you'll see for greater than 150 centimeters, you are to use 43645. So make sure that you pay attention to the size or the length of the limb. Okay. Also, this is a laparoscopic procedure, but as long as you can get to the procedure, you can always be directed to the right location, because the last little parenthetical note at the bottom of page 281 states for open procedures, you are to use 43846. So what I would do is just write open with an arrow to that CPT code. So now you know where to go for laparoscopic and you know where to go for open as far as the bypass. Okay. Also, when you're coding for a gastric bypass, also make sure that you pick up whether the patient is obese or morbidly obese. There's an I-10 code for that, and it will let you know whether the patient is obese or morbidly obese in the question itself. Okay. Enterostomy on the bottom of slide 180, that's just basically an opening. Remember that ostomy is an opening. And then the presentation goes on to just break down the additional body parts that can be coded. So here they have rectum and anus. We have discussed hemorrhoids before. Okay. And when you're coding for hemorrhoids, remember there's a couple of steps. And whether it's a group or a column, you need to know how many groups, how many columns, and whether it's internal or external. Okay? Whether it's internal or external, and how many groups or columns when you're coding for hemorrhoid removals. Okay. Moving on down to slide 183. I'm looking at slide 183. Again, most important thing on this slide, where it has drainage of abscess, it does tell you that you need to look for, if they're going in for a drainage of an abscess, the approach, whether it was open or percutaneous. Percutaneous meaning through the skin. So when you're talking, or if you get to a question in reference to an abscess drainage in the digestive system, you will be looking for the approach, whether it's open or percutaneous. Okay. The hernia codes, same thing with the hernia codes as far as it being open or laparoscopic. Okay. Hernias start 436 because you have open and then you also have closed hernia repairs. I'm sorry, laparoscopic hernia repairs. Your laparoscopic hernia repairs are on page 316 in your CPT, and your open begins on page 314 and 315. What I need you to remember when you're coding for your hernias, you can see the 3 steps there. You need to know the type of hernia, right? What type, the name of the hernia, whether it's strangulated or incarcerated, because that will also increase the reimbursement for the provider once you're able to narrow down whether there's some type of obstruction with the hernia. So sometimes you'll see the word incarcerated, sometimes you'll see strangulated, or sometimes you'll see obstructed. Okay, so that may be one you need to add on: strangulated, incarcerated, or obstruction. Okay. And then also if it's an initial or a subsequent repair, was it something that they fixed and it came back? So you're looking for those 3 things when you are coding for hernias, and then whether it's open or laparoscopic. If it's open and they use mesh, remember the value of your CPT code 49568. CPT code 49568 gives you a range of codes that you can use it with if you're looking on page 315. Hopefully, in your book, you're going to draw a line from CPT code 49560 through 49566. And on the outside of that line, you'll put a plus sign 49568. So those, or that particular section of codes, are the ones that can only be used only with CPT code 49568, which is an add-on code. okay, which is an add-on code. All right, so just remember that about the hernias. And then finally, in the digestive system, something for you to be aware of, which I mentioned a little earlier, you're going to need to know the HCPC codes for colorectal cancer screening, right? So you may say to yourself, how do I look that up? Colorectal cancer screening. If you are in your HCPCS book, your first term is going to be screening. You can look up the term screening in your HCPCS, and then it will give you the range for colorectal. Okay. And just remember, if anyone has a family history or if someone in the family has also had a colon cancer, then the patient becomes high risk. The patient becomes high risk. Also on page 295, there is a colonoscopy decision table. But remember that this particular table on page 295, excuse me, is for those who are not Medicare recipients. If it's a Medicare patient, you're going to divert back to your HCPCS book. And let me just see if there's anything else in here. I'm just going quickly to see if I remember. We still have a boot camp next week, so we'll be going over a lot of this stuff again, making sure you have everything you need in your book. So your need to knows, sorry, your need to knows for the digestive system, which we'll talk about again next week. Tonsillectomies, remember tonsillectomies, where to go. If they've also had their adenoids removed, because if so, then there's a combination code, right, for tonsils. For tonsils and also for adenoids. There is a combination, and you have to remember their age, right? Key age there is going to be 12, whether they're 12 or over or under 12. The next thing you need to make sure you pay attention to that we've mentioned in reference to the digestive system is going to be hernias, right? Hernias, remember how is the procedure performed, whether it's open or laparoscopic, the type of hernia, whether it's strangulated or incarcerated, and then whether it's recurrent or not. Knowing those steps will help you select the correct answer for your hernia repair. And just remember the mesh code when it's open. The mesh is included in the laparoscopic procedure code, so you're not going to need to add that if it occurs, but you do need to apply it if it is a open procedure. Okay, and it has the codes. It has the codes that you're able to use them with. Okay, for the hernias. Make sure you understand about your colonoscopies, coding for colonoscopies, that you need to be pay attention if it's a Medicare patient, because then you're going to have to go to your HCPCS. Make sure you understand the ICD-10 code for morbid obesity. So there's a code for obesity, and then there's a code for morbid obesity, right? You need to know the I-10 code. And remember, when you are coding for gastric bypass procedures, you may also have to capture the body mass index. Okay. And also, when you're coding for gastric bypass procedures, consider the length of the limb and the approach, whether it was performed laparoscopically or open. And gastrostomy, again, that's a procedure when they're going to place a feeding tube. So you need to know the procedure code for a feeding tube placement. I believe it's 43246. 43246. So just jot that down and just look that up. And common modifiers within the digestive system are going to be like 78, which is like a repeat procedure, 54, which is surgical care only, 76 is repeat procedure, and 58 is staged. Okay, so those are just some common ones, 78, 54, 76, and 58. And then your hemorrhoids. Remember when you're coding for hemorrhoids, how many columns or groups and whether they're internal or external. Okay. And so you know that if I've given you an example of hemorrhoids, then you may have to also know the CPT codes, those code ranges, and I believe that's on page 300 for your hemorrhoid. Let me just double check. Yes, page 300 is where your hemorrhoid procedures, and you should have the steps on that page also on how to code for those. The appendix is appendectomy, can also be performed open or laparoscopic. Remember, this is the digestive system. And so with an appendectomy, that patient's going to have appendicitis. So you need to make sure you know the I-10 code for appendicitis. I think it's K35.80. Just double check. And then the last thing that they didn't have on here is going to be ablation of like your liver tumors. Let me not say ablation because that's just one way of destroying it, but destruction, right? So you'd look for destroy or destruction if they said they were destroyed of liver tumors. And when you're coding for the destruction of liver tumors, you're going to look at the approach and if there was guidance used and what method was used. Like, was it cryosurgery? You know, what type of method was used to destroy the liver tumors? And I believe liver tumors are discussed on page 304. On page 304. Okay, so if you're looking at page 304 in the CPT, right now I'm just looking for example CPT code 47382. As you can see, it says ablation, one or more liver tumors, right? So if it's 15, don't let them trick you. It's still going to be just that 47382. What you're looking for on this page is the approach or the method. With CPT code 47382, you can see that the approach or the method is percutaneous through the skin, and then it says radio frequency, so they're destroying it with radio frequency waves through the skin. And if you look at CPT code 47383, it's also through the skin, but now it says cryoablation, which is freezing, right? So there's two different methods, so make sure you pay attention to the method of destruction on those codes. Liver tumors also start at the bottom of page 303 under other procedures. Under other procedures. Okay. Also, page 296, I'm just flipping through. I'm sure I'll mention this again when we go over it again next week. Page 296. The bottom box where it has the definition of a colonoscopy, please make sure you read that. Make sure you read that because it tells you when you need to use modifier 53, which is explained in the last two sentences on page 296 in that box. All right, moving on. Urinary in male. Urinary in male. So the urinary system begins on page 317. And just like I always like to introduce the reference pages, it's the same thing. Look, the urinary system is only a page, really. You turn over and then they're just talking about urethra. So again, when you get a question from the urinary system, it's only going to be in reference to your kidney, your ureters, your bladder, or the urethra, right? It's only going to be in reference to that. Please remember that the 50,000s include urinary, male, female systems. So you have the male, the female, and you have urinary in the 50,000s. So there's what? 1, 2, 3 different systems covered, but there's only going to be 10 questions to represent the 50,000s. So let's just discuss a few things. With the urinary, it's some of the things that you need to know. A cystourethropy is definitely something that you need to become familiar with. Looking up those procedures, I would suggest that you start from the index cystourethropy, and the index page would be, is it 821? Let me see. 821. Yes, it's back there, cystourethropy. And as you can see under that term, and that's why I sent you back on this side, because there's so many different procedures that can be performed in combination with a cyst, because actually cysto, they're going in there to look right at the urethra with a scope. And so they could be looking to do many different things. And so now that you found the term cystourethropy in your question, your next step is, okay, and what else are they doing with that particular procedure? And you'd look for that term, like they have catheterization and urethral catheterization. It gives you two codes, 52005, 52320. You would read your question and then be able to decipher between those two codes. Okay, so that's for cystourethropy. Let's see what else would fall. Bladder tumors is another common one in this section. Bladder tumors, and those can be found on page 333. So I'm just reading from the need to knows, and you should have the same thing. And if you don't have the page numbers, that's something that you need to do, because you have the need to know tips. And so you need to know where to find those in your book, and what other better place to find them, or to remember than to write it in your notes, because these are common procedures in this area. So bladder tumors, I said, was on page 333. And remember, when you're coding for bladder tumors, you have to consider the size of the tumor. It's either small, medium, or large. Just remember. And also, this is also a continuation of your cystourethropy that come over from page 332. Page 332 can also be found in the same area. Okay. Last thing, I think of the renal tumors. And your renal tumors, this is just for the urinary system. Your renal tumors are found on page 319. Not renal tumors, just abscess. Okay, and that's going to be found when it's renal. Make sure you're there pertaining to the kidney. And there's two CPT codes on page 319. You have CPT 50010 and 50020. One, the 50010 is just an exploration. Okay, so they're not doing any other procedures, they're just looking. But 50020 is drainage of a renal abscess. So just remember that. And the procedure, the approach is open. Okay. So that's on the urinary. Let's get over to the male. Because as you can see on the slide here, maybe you would want to just see the anatomy of the urinary system. You have two kidneys, and it just kind of describes how it works. Those are considered your filters, the kidneys. And then you have your renal pelvis, one per kidney. Okay. And then you have two ureters, which are like your little tubes, and those connect to the bladder. And then you have your urethra for the exit of urine. And just pay attention to these terms. Renal means related to the kidney, and nephro, they are talking about the kidney, because some people get confused with nephro and renal. They're both pertaining to the kidney. Nephro is to describe the kidney. Right? So if I said nephrectomy, you don't say kidnectomy, right? So nephro is pertaining to the kidney, and renal is related to the kidney. And then you have pylo there, which is the renal pelvis. See, and then moving on to the male system. This is, again, that starts on page 339, but this is also a very short chapter. The majority, I'm going to say, you will get equal distribution. You will get questions from each three in this particular category. In the male, you can see that the reference page starts on 339. And again, you can look at the various anatomy of the penis, how it's broken down. And again, if you're looking at your questions, you're looking for that body part. For the most part, for the male system, of course, they're going to want to ask what's going to be common is going to be a circumcision, right? A male circumcision. Circumcisions can be found on page 341. Page 341. The two codes I want to bring to your attention is going to be CPT code 54150 and 54160. So if you haven't written it already, this is the page where you have your circumcisions on page 341. And CPT code 54150, very important, where it states circumcision using clamp or other device with regional dorsal penile or ring block. Make sure you highlight that, with dorsal penile or ring block. And the reason I'm stressing that is if you drop down two little parenthetical notes later, it will say report CPT code 54150 with modifier 52. So that's going to be important, right? When performed without a dorsal penile or ring block. So one is with, one's without. So when you're coding a circumcision question, of course, now in your head, you're going to be asking yourself, was there a ring block used or not? So you'll be able to select whether or not you need to append that modifier 52. All right, that's important. And then the age of the patient, or it could be an incomplete circumcision, but usually they'll try and test to see if you know when to append that modifier 52. So I'm pretty sure you'll see that. Another area in the male system for you to pay attention to is going to be the penile prosthesis. Penile prosthesis. You should be able to just turn straight to that page because that should be in your need to know, which should be page 342. Page 342. That's the penile prosthesis. As a matter of fact, you should even have that written at the top of your page. Okay, penile prosthesis. And I'm looking at the codes on the right-hand side of page 342, starting with CPT code 54406. So basically, these are all procedures pertaining to a prosthesis for the penis. 54406 is removal of all components. You want to highlight these main terms, right? 54406 is removal of all components. 54408, that is a repair. See, one's a repair, one's a removal. 54410 is a removal and a replacement. So, you have to kind of read and see what are they getting ready to do. Okay. Okay, the difference between 54410 and the difference between 54411 is that 54411 is already going to perform this procedure through an infected field. Through an infected field. Please make sure you highlight that. 54411 through an infected field. Okay. And jump on down to CPT code 54417. This is also a removal and replacement. Okay, but it's happening at the same time as a major procedure. So just remember that for CPT code 54417. If you can see, it's also being performed through an infected field at the same operative session. Okay, and the other one is not. So there's a difference. Last thing for the male on page 343. That's in reference to the orchiopexy, right? Orchiopexy is undescended testicles. And when you're coding for that, what you're looking for is the approach that they use for the testicles to descend. Okay, if you look at CPT code, I'm on page 343. I'm on page 343. If you look at CPT code 54450, that's for the exploration of the undescended testes. And if they're looking at both sides, make sure you append modifier 50. Okay, so you see that's under exploration. If they repair, you're going to drop down to the next set of codes. If they're doing any type of repair, look at CPT code 54640. That's telling you that it's an orthopexy, but it's an inguinal approach, right? 54650 is an abdominal approach. Okay, so just make sure that you're paying attention to the approaches and that you have them highlighted. Okay, I think that's it for the male. And of course, we're going to go on to the female procedures. And page 348 is a nice blank page if you still need to put some need to knows. And the female reference page, let me just go on down here to make sure I haven't missed a few tips. This is just the common terms for the male. And again, these are just the steps that they're telling you. I'm looking at slide 196, where it has CPT urinary. And as you can see here, like they have the bullet points, it's arranged by the location and then again by procedure type. We got to get familiar with what the procedure type. And when I say procedure type, whether it's an incision, excision, repair, you got to read the question and really analyze it and just look and see what is it exactly that they're getting ready to do to this patient. Right, so we can make sure we end up on the right page. And those reference pages, I'm telling you, are great. But if I see a terminology word that I can look up in the index, I'm going to do that too, whichever one makes me move a little quicker. But to be a lot more precise, I'm definitely going to be looking at my reference pages, the body part, and I want to see what's being performed. They also have operating microscope under urinary. Now, a lot of CPT codes include the use of a operating microscope. So I just wanted to just mention, make sure you read your terms or the definitions before you apply or add on CPT code 69990, which I believe is an add-on code anyway. So you'll see the plus sign, and also make sure you read the definition of the CPT code to know whether you're going to need to add that on. Okay. Remember that you also have a copy of this, and I will send out the little recording. And again, I never know what type of terminology they're going to ask. So when you have presentations like this, or you have access to materials like this, again, for each of the sections, they do give you common terms. So you may want to, just make sure you're comfortable with the terms that you see here. Like we spoke about nephropylo. So we already know, those are pertaining to the kidney and the renal pelvis, right? So as long as you are understanding your prefixes and your suffixes, then you should be good as far as the terminology, but you do have to understand the root word and the body system that it pertains to. Okay. I was just getting back to the mail. So the mail, let's see what they had. So the main thing for the mail, as you can see, they just narrowed down the CPT to one little slide. Incision, yep, you can see the different categories. You just need to know what body part here. It's talking about the penis. So destruction, excision. You just have to understand. Again, I'm going to keep drilling it into your head to look for the actual procedure. What is the action in this question? The I-10 is easy because it's always talking about the disease, and it's very, very detailed because I-10 has expanded so much, you're able to drill it down. But you also have to kind of take those same practices into the CPT and understand exactly what you're looking for when you're reading these questions. And what you're looking for is the action. Yes, you can find the diagnosis, but I need to know what's going on, what body part are we talking about in this question, and what are they getting ready to do to that body part. So I know where to go on my reference page. And the more you practice that, the easier it will be to maneuver through the book. Also, when you see terminology terms in your question, understand that your terminology word is an action, right? And when I say terminology word, I'm talking about the ones that have your root word, either a prefix and a suffix, that's telling you something that's happening. So that way you can use those terms in the index to kind of help you also. Right. Circumcision, we spoke about that. Very important to make sure you know whether or not to utilize modifier 52. Female genital system. Okay. Main thing in here, again, the reference page starts on page 349. Page 349 is the reference page for the female. Okay. Starts page 349 and 350. The biggest part here is maybe going to be in the maternity care and delivery, right? Very big section of the I-10 also. Pregnancy codes. As far as I-10, remember that you're going to continue to utilize O codes, right? That's for mom. 6 weeks after delivery, you'll still be using those codes. Okay? After delivery, up to 6 weeks. If it's a complication, if a pregnancy leads to a complication, remember that your complication code is going to be listed first. Alrighty. Up top, the anatomy. You could always look at that slide, but you do have a little image on page 349. Page 349 in your CPT. Chapters 14, 15, 2, and 21, they're saying in reference to the female genital system, but you don't need to remember those. You just need to know how to read your question and look them up. Just want to make sure what section I want to focus on here for you. I'm going to drop down to slide 208. And again, remember, we're going to discuss it a little bit more next week when we do our webinar for our boot camp. I'm going to leave the lines open the entire time because I really need to feel confident with you and this information, and I need to have some type of open discussion so I can make sure that you're understanding or understood the content. Okay, so I don't believe I have anyone testing in October. The next one I believe is going to be that November. Okay, let's see. I'm just looking at some paperwork right here. All right, so back to the female genital system. Under slide 208 for hysterectomy, remember The TAH and the TVH, I think we did write those in our books, right? Those are in reference to the hysterectomies, which are on page 356. Page 356 is where you'll find the hysterectomy procedures. And remember, with the female system, with the hysterectomies, there is also open and laparoscopic hysterectomy procedures. So you have to read and see whether it's open or laparoscopic being performed. Here's an acronym over here on 207, slide 207. OS stands for opening of the cervix. All right, and we'll talk about, so we have the hysterectomies, because I want to get into the deliveries. On page 351, turn back for a second, page 351 in your CPT. Next to CPT code 56501. Okay, because it says here destruction of lesions on the vulva. I want you to know that the labia, the mons pubis, are part of the vulva. Just so you know, because sometimes in the question they may just say pubis. You need to know to refer back to vulva. So I want you to write labia, L-A-B-I-A, comma, mons pubis are part of the vulva. So you know it can be used with that CPT code. And that's for destruction of lesions, right? And then as far as the destruction, there's only 2 codes to choose from, with the 56515 being the extensive. Okay. Remember the different keywords we used for simple and extensive? Alrighty. So let's look back at the maternity, since we spoke about the lesions there. Where's my maternity? This is going to start the 5-9s, right? Remember, your hysterectomies are whether they are open or laparoscopic. On page 360, that gives you 2 codes for a couple of codes for in vitro fertilization. Make sure you know what page to go to for in vitro fertilization, which is page 360. 360. And on the bottom of page 360 begins where maternity care and delivery begins in your CPT 2016. Right? Remember, there's different packages. When I say packages, I'm talking about antepartum care, postpartum care. Antepartum care are going to be the visits before baby, right? That's your initial visit during pregnancy. Takes about, they provide at least 13 visits. 13 visits they state is part of the global package. Okay? The OB package includes the baby being born, the episiotomy, if they have to cut mom, and repair, and also postpartum care. Okay, and you're like, what's postpartum care? Remember 6 weeks? So it's, remember, they do another checkup 6 weeks after they have delivered. So if anything occurs during that time span, you are to refer back to your I-10 codes that begin with O. Okay, to the mom codes. And if they have to do any type of checkup after a cesarean delivery, that's also covered. That's also covered in the 6-week checkup. Okay. Talk about deliveries. Okay, and they have here partial maternity care, but that's like if, remember, the person could be pregnant and they're started their whole pregnancy in New York, and then they come down to deliver in Georgia, then the provider in Georgia can only bill for delivery only and maybe the aftercare, right? So that's what they mean when they say partial. Okay. Let's talk about cesarean deliveries, right? Remember cesarean deliveries? Cesarean deliveries, if mom has twins, I'm looking in my CPT right now. If mom has twins and it's a routine delivery, meaning the doctor took care of her before and after, then you would use 59510, right? That's the routine. If they have twins, both babies are going to be delivered from that same incision. However, if mom had twins and they were delivered vaginally, you would have CPT code 59400 and then 59409 for baby number 2. So remember, if they're twins and they're born cesarean, there's only one CPT. If they're twins and they're born vaginally, then there's two CPTs, 59400 and 59409 for baby number 2. If mom has twins and one is born cesarean and one is vaginal, right? You're going to use the 59510 first because the cesarean delivery is more labor intensive. And then you'll add the 59409 on for the second baby that was born vaginally. All right. Hope everyone's clear on the deliveries because you're definitely going to see that for sure. And also on the abortion category. Okay. So there's two types of abortion. They have spontaneous and induced. And sometimes for the term spontaneous, they'll use miscarriage, right? And so when it's that type of spontaneous miscarriage, is it complete or is it missed? And if it is missed, they state that a D&C may be required. That's dilation and curettage to clean the lining of the uterus. Right. Endocrine system, endocrine and nervous. This is a very simple system when we went through it. All right, so that's starting on page 367 for the nervous system. Wait, let me go back to endocrine. Endocrine is on page 364. Main thing you need to focus on for endocrine is your lobectomies and your thyroidectomies. It's not even a whole page for that particular system, right? I'm on page 364. I'm looking at CPT code 60210. That's a partial. Make sure you highlight that. That's a partial thyroid lobectomy, unilateral, meaning on one side. And on CPT code 60212 with contralateral meaning on the other side. Okay. And then CPT code 60220 is a total thyroid lobectomy. So remember, that's to do with the lobes. Okay. The thyroidectomy itself on page 365, CPT code 60240, or the person, it may be performed because the patient has cancer, which would be CPT code 60252. And 60254, where it says with radical neck dissection, that means they're also going to remove a few lymph nodes. Remember that term, radical. And then you have thyroidectomy 60260. And that's, you use that particular procedure when the person already had a portion of the thyroid removed. And 60500 towards the bottom of the page, 60500. 60500 is just the exploration of the parathyroids. What are the parathyroids? If you look at the image on page 365, those 4 blue dots, those are your parathyroids. And when the provider performs a thyroidectomy, he will explore the parathyroids to make sure that there's no damage there is no damage performed. Okay, so that's the endocrine. And the nervous system, remember the nervous system is compromised into two parts. They have the CNS and the PNS. CNS, central nervous system, consists of the brain and the spinal cord, and PNS is peripheral nervous system. All right, so let me just make sure. No, that was the 5s. Okay, so on to the 6s. You should have your need to knows in this area. And remember, when you are coding for the nervous system is broken up into 3 categories. 3 categories. If you look on page 367, I'm looking at the red headlining. So this is the body parts that you need to look for when you get to nervous system, right? Because there's only going to be 10 questions. It's comprised of endocrine, so that you see endocrine is really short. So the majority of your questions from the 60,000s is going to come from the nervous system, right? Or the senses, including the senses. So make sure that's the nervous system. And then you have 6s with the eyes will fall into that category also. But going back to the nervous system, 3 sections. You have the skull, meninges, and brain. And then on page 368, you have the spine and the spinal cord. And then on page 369, you have your nerves, right? So anytime it's anything to do with nerves, any type of procedure, this is the nervous system, right? You have to look for the name of the nerve. Spine and spinal cord, self-explanatory. You're going to look on page 368 and look what they're doing to the spine or the spinal cord. It will be one of these listed in blue, right? On page 367, the key terms for you to know to use page 367, the procedure is going to be performed on the skull, the meninges, and the brain. But once you start to see terms like peripheral nerves and extracranial nerves, you know that you need to be looking on page 369. So again, it's broken up into 3 sections. It's either the head, the spine, or the nerves. And so once you figure out which category, then you'll look for your blue indentations to take you to the page for that particular procedure. As you can see, actually the spine and spinal cord on page 368, they have a lot more procedures, but they're very clear cut, right? So you have to make sure you're reading for those. Page 370, that's when we talked about the twist drill and the burr holes. Remember that your burr hole is a bigger drill, right? And it goes into the cranium, and usually it's used to release subdural hematomas, right? And a twist drill is a lot smaller than a burr hole, and that drill is used to like insert some type of catheter or some type of monitoring device on the brain. So the twist drill is a little bit smaller than the burr hole. Right? Okay. Craniectomies at the bottom of page 370. Make sure when you're coding for craniectomies that you consider the approach. Okay. Right. And page 372 is where they start to give you definitions that you may need to be familiar with in reference to the skull. Okay, so they talk about it there. And then the pages in between are basically going to be about how to break down each of those sections. So if you're looking on, for example, if you're looking on page 370, you'll see it starts with all of those procedures for the skull. So it's basically a breakdown. It's a breakdown of page 367. And then the next section they'll go into will be the spine and the spinal cord. And then they'll do all of the procedures under the different types of nerve. So it's important not to get too consumed with the nervous system. It seems like a big system, but because it's so detailed on the breakdown, you'll be fine as far as make sure you read. What else do I need you to know in here? Craniectomies. I said make sure you pay attention. Craniectomy and craniotomies, they both fall together. See? Cerebral spinal fluid, I'm on page 380. These are shunt procedures. Page 380, you can see the shunt, the image there that's been inserted, the catheter. And so what I did was on page 380, like starting with CPT code 62225, make sure you, again, you highlight those main terms that are jumping out of the definition so your eyes are not searching for it. CPT code 62225 is replacement. Then you have a replacement or revision, and then you have reprogramming, and then you have removal, and then you have removal with replacement. So very straightforward as to what they're doing. You just have to find that procedure in your question. Okay. Always look for the approach. The approach is what's important in the nervous system. Page 385 in your CPT. Page 385 in the CPT, I'm going to have, you should have, look for the approach at the top. Make sure you're looking for the approach and what area they're performing the procedure on. For example, is it lumbar? Is it a lumbar area? Is it cervical? Is it thoracic? So you have to make sure you're paying attention to that and what area those laminectomies are being performed on. Okay. Let's going on through. And facet joint injections is another common procedure that's found on page 392, facet joint injections. These are just in reference to I-10. Still on the nervous system. And we spoke about the cerebral spinal shunt procedures. Yep, same thing. As you look here on the nervous system, on the decompression, main thing in the nervous system, you got to think about the approach. To the left side here, where it talks about laminectomy versus laminotomy, right? Remember, ectomy is a removal, otomy, opening. So is it complete or partial excision of the lamina? That's the little bone that's on just past that. So on page 384, the little image on page 384 in your CPT, that's what the laminotomy or laminectomy procedures are referring to. That's where you actually find those procedures on page 384. So are they doing an opening to insert some type of rod, or are they doing an ectomy, which is removal of that particular segment or a part of that segment, right? See what else? Oh, facet joint injections, back to that. That's found on page 392. And some of those common codes for facet joint injections are CPT code 64493. You need to know the name or how many levels. CPT code 64493 is an injection. Diagnostic or therapeutic, so they could be looking or treating, right? Diagnostic, therapeutic is to treat. and it says a paravertebral facet joint. And that's only the single level. So of course you're looking to see how many levels. 64494 is going to be your additional or your second, and then 64495 is third and any additional. So that means if you're doing any add-ons after the third level, you would be using 64495. You just have to pay attention to the nerves that are being addressed. As you can see, this is atomic nerve, and then you get to page 393. And then they start talking about peripheral nerve or vagus nerve. So just make sure you pay attention to the name of the nerve. And here again with the facet joint injections, which nerve, number of levels. Neuropathy, make sure you know the CPT code for that. That's suturing of a nerve. I think I did have that somewhere written down. That should be actually in your need to knows for your 60,000s, the need to knows. Let me see if I have a page on that. You can actually, because of that procedure, you can actually find that in the index. That's the suturing of the nerve. I'm just going to look it up real quick in the index. Okay, that's on page 914. So you can go straight to 914. That's the suturing of the nerve, and then all you need to know is whether it has a conduit or a graft is involved, so you know which range of codes to go to. So you notice, go up a little bit, you could even see neuroplasty on page 914. So again, in the index, remember the index is terminology words, and names of procedures are what you're going to find back here to help you. All right. And your eyes, let's see. Very important on the senses part with the eyes, where it has anatomy, ear, and auditory system. Make sure you understand what's involved in the middle ear. The middle ear. So see, they tell you the middle ear, that's where you're going to find your tympanic membrane, your ossicles, which are the small bones in your ear, the malleus, the incus, and the stapes, and also procedures. That's where they insert the station tubes. So usually that happens with children, right? And because the tract from their mouth to their ear is so short, they usually get a lot of infections because kids like to pick up things, and that's one of the main purposes of having a station tube inserted. Make sure you understand those parts of the middle ear. You should have tympanic membrane, and then these are the bones, ossicles, the names of the bones, 3 bones here, and your station tube. As far as the senses, where it has eye and ocular anexa, main definitions here, remember strabismus surgery? Strabismus surgery, where is that? That is going to be on page 410. And when you're coding for strabismus surgery, you need to know what type of muscles. It could be horizontal or vertical, so you need to know the type of muscles. You also need to know I-10 code for cataracts and glaucoma. Cataracts and glaucoma. I-10 code. Also the definitions of the eyeball. Underneath the eyeball, you see evisceration, extenturation, and enucleation. Make sure you know the definitions of those. Where is that? That is going to be, you would want to write those on page 403 because that's where you're going to find those terms. Evisceration is CPT code 65091. Enucleation 65101. And extenteration 65110. Make sure you have those definitions there. You want to write them on page 403 in your 2016. And basically, it's just letting you know these are all procedures on the eyeball. It's just a matter of whether the muscle and the contents are attached or not. And each of these terms will describe whether the muscle is attached to the eyeball or whether the eyeball procedure is coming out with the contents. So make sure that you have the definitions for those. All right, we were just talking about strabismus surgery with the horizontal and the vertical. Definitely where it has intraocular lens procedures, more than likely you're going to get one from there. And those are found on page 407 in your CPT, starting with CPT code 66982. So where you see IOL, that acronym down there, intraocular lens procedures is what that stands for. And it's either going to be intracapsular or extracapsular. So make sure that you highlight those terms. Extracapsular in 66982, intracapsular in 66983. Just have to read and see what they're doing. And they talk about operating microscope. You do understand, just like before, if it's operating, the use of an operating microscope is in the definition, then you do not need to add on that CPT. Okay. And it will say operating microscope was used, and then you'll look for the CPT and see if that's included. For the most part, on the ones that we have had to be tested on, most of the operating microscopes are going to be included in the CPT. When you think about the auditory system, of course, it's talking about your ear, so you may have to code foreign body removal from the ear. Usually takes place in the middle ear, and that's why I want you to make sure you understand how that's composed. And here it tells you middle ear and the different types of procedures in the middle ear, and then inner ear. But usually they ask from the middle ear. Moving on to anesthesia, this should be a very, very easy section. So what I want to do for anesthesia is just, again, go over your steps to code for anesthesia because you guys didn't have any problem in this area. Remember, main thing for anesthesia, to remember the age of the patient, whether they are under 1 or over 70, right? What body area is the anesthesia going to be administered to, right? And whether there is a physical status modifier needed or not. Remember, your physical status modifier is the condition of the patient before surgery. Right? The condition of the patient before surgery. P1 being a normal, healthy patient, all the way to P6, meaning that the patient is brain dead, right? And then your qualifying circumstances, that's when we were talking about under 1 over 70. If that applies, you will add on CPT code 99100. However, be careful on the procedures that are performed on babies or infants under 1, because sometimes that 99100 is rolled up into the CPT code definition. Right? For example, if you look on page 56, and you look at CPT code 00326, and you look right underneath it, parenthetical notes, it states Do not report 00326 in conjunction with 99100, although the patient is under 1. So make sure you're reading the definitions and looking to see if there's any additional steps listed in the parentheticals. Okay? So again, when you're looking up anesthesia, I need to know what my body part is, right? What type of surgery, what's the approach, and then the different types of anesthesia. And please don't forget your modifiers. Remember, there's anesthesia modifiers that you should have had written in your book. And we'll make sure you have those all jotted down when we meet next week for our webinar for the boot camp. Okay, and it tells you, remember, sometimes they will also ask information about anesthesia time and when it starts, and that information can be found on your green reference pages on page 54, where under time reporting. And then on the left-hand side of that same page, on page 54, 1, 2, 3, the fourth paragraph down, I need you to highlight that where it says to report moderate sedation. It tells you what codes to see. So you'll know that these codes are to report moderate sedation on page 54. Okay, so we spoke about the P status modifiers, P1 through P6, and also about those qualifying circumstances. That information, again, can be found on page 55 in the 2016 CPT Professional. And here are the anesthesia modifiers. A good place to write them would be page 55. AA, AD, you should already have these. QK, QS, QX, QY, and QZ. And then you can write those definitions in your book. Or at least know where to find them in your HCPCS book. Right? And then again, discontinued modifier 53 and modifier 59. Okay. 53 if the surgeon discontinues the procedure, and we know one of the examples of using modifier 53 is if the patient begins to hemorrhage during surgery, right? 53 and 52 are two different modifiers. 52 is just reduced, 53 is discontinued. Okay, so they just have a few additional procedures there listed. And then radiology, E&M, I'm going to leave for our boot camp because we'll be going through this again next week. So I'll be able to wrap this up for you guys in about 10 minutes, maybe. We can do radiology, lab and path, and medicine. And radiology was super easy for you guys to remember. Let's move on. Let's go to radiology. That's your 70,000s. Kind of flipping through this book. By now, you should be really comfortable moving through this thing. So radiology, where are we going to be? We're going to be on page 423. That's going to be your reference page. Right? Remember the different projections. There's different projections of the beams. And they may ask a particular projection. They may say an X-ray beam enters the body through the front and exits through the back. You know, name the projection of this X-ray beam, and you would need to know anterior, posterior. If you are not comfortable with the projections and the different paths of the X-ray beams, please remember in the beginning of your CPT I believe it's on Roman numeral 21. It's in the beginning of the book, first couple of pages. You'll see it shows the various body planes. That may be a great place to write those projections, or you can just use the other half of page 422. So make sure you have these, because I don't know what terms. And again, we're going to utilize the materials that they provide us, and because that's where the questions are coming from, including terminology. So if this is not something that you're comfortable with, you need to get it in your book. Not excessive writing, just tips to help you in that particular area. Week 2, we talked about the different terms and terminology. Proximal and distal was definitely 2 on that list. Proximal being closest to the point of attachment and distal being the furthest away, right? So for example, your wrist is distal to your elbow and your shoulder is proximal, right? Because it's closest to the part of attachment. If we're using the elbow as the center piece. As far as radiology, we have to remember when it's being administered, is it being administered with or without contrast, right? Main thing, what is this patient getting? An MRI, CT, an X-ray, or ultrasound? So I know what category to go under, right? Because if you're looking at page 423, those are going to be your X-rays, right? And then it goes down, and then you have your ultrasounds. You turn to page 424, that's where you're going to have your guidance. And then you have procedures on your breast, and then nuclear medicine. For the most part, they'll maybe ask about either an X-ray, MRI, CT scan, definitely something from the obstetrics section, which is going to be on page 439 in your CPT. DEXA scans, right? This should also be in your need to know. In your need to knows for radiology. MRI, CTs, and X-rays, ultrasounds. Vascular flow, which can be found on page 440. Mammogram is computer-aided detection used, because that's going to be an add-on code. Okay. Remember, your modifiers TC and 26 are very important in the radiology section. TC covers the supplies, the room, the gown, so basically, and the overhead and the equipment. That's usually done in a facility setting, right? And then your professional component, which is modifier 26, is the provider reading the results of them performing the test using the equipment. So as far as reimbursement, the TC part usually gets about 75%, and the professional component usually gets the remaining 25%, because that's just the provider reading it. If the provider owns the equipment and the test is being performed in his facility or in his office, let me not use the term facility, in his office, then you do not need to append a modifier because he owns everything, right? So you're not going to need to break it down and put 26, because he also is billing for the technical component of that service. Okay. Again, MRIs, CTs, X-rays. So you're looking, that's how it's, when they say anatomical organization, that's how it's broken down in your reference pages. Okay. And here's a good overview of what to do as far as your steps to code for radiology. I like this, right? So they have first, you need to know the anatomical location. Where are we? What body part are we getting ready to perform this radiology procedure on? What type of procedure? Type of procedure is like what we said. Is it an X-ray? Is it an MRI? Is it a CT? Is it an ultrasound, right? They're going to say patient comes in for, so they're going to give you that. You're not going to have to figure it out. How many views? The number of views. Is it 1 view, 2 views, minimum of 4 views? You're going to have to get that information from your question. And remember, we were just talking about the different types of views, anterior, posterior, right? That's what that acronym stands for. So the type of view. And these are just steps. Not everyone you're going to have to use the same steps, but this is giving you just like a little rule for you to follow when you're coding radiology. And then is laterality, is it bilateral, unilateral? Is it mentioned in the question? Does it say bilateral? But in your definition, it only says unilateral. So now you know you need to append, modifier 50. So laterality. And then again, is contrast material used? With or without contrast? So those are what, 6 steps to code for radiology. Oh, the vascular, let's see where we're going. Of course, there's obstetrical ultrasounds too. That's going to be found on page 439. And then you can look and see if there's guidance. So guidance is like if they want to insert like some type of catheter. So don't get radiologic guidance confused with an actual X-ray, right? Because the guidance, they're using it to insert some type of device. Okay, so on the left-hand side where it says ultrasonic guidance, these are some of the examples that they would use that particular type of guidance if they need to remove fluid, right? Pericardiocentesis, removing fluid from around the heart. If they need to gain vascular access, if they need to place a needle, that's what they're saying when they say guidance. You just need to know the type of guidance. And then we go about talking about the breast again. Is it screening or diagnostic? At this point, the terms and what I'm discussing with you should all sound familiar. And I hope that you guys have been using the practice test that is available to you on the AAPC website. Let's see what else. Those are just other radiology. Path and lab. Again, these CLIA number. Remember, so we're moving on to the 80,000s. 80,000. So I am now on page 471. Just kind of flipping through this book. And remember, there's modifiers. They have, let me see what they have. They have 90, 91, 92, 99. But don't forget about QW, which actually goes with that CLIA. You see that CLIA up there? Remember, a CLIA number basically is given to providers to submit some type of laboratory specimen. But they have what they call CLIA waive test, meaning that they don't have to have a CLIA number to perform these 80 tests, right? So there's a list that they will review. These are a list that can be billed actually in the provider setting. If the test is CLIA waived, then it will have a QW appended. So anytime you see CLIA in your question, you need to look for an answer that has a QW on it. Okay, the other two, get rid of them, and then you can break it down from there. When you see the acronym CLIA, C-L-I-A, on your multiple choice, you should have the QW appended to the CPT code. Okay, and also another modifier they don't have here, which I want to share with you, is that GA modifier, and that's when they have assigned advanced beneficiary notice. Remember, laboratories, sometimes insurance companies don't pay. They will exclude those services directly, or have LabCorp or Quest Diagnostics, a company like that, perform the test. So if the tests are sent outside, or if the test may not be paid, right? So that, remember the ABN, we're going to render some services in the event that these services are not covered. You're going to sign this paper so we can bill you, right? And that signed paper, that ABN signed paper, to know that they have done that, there will be a modifier GA at the end of the CPT code, modifier GA. The CPT code would represent the test that may not be covered, right? So when Medicare sees it come across and it has a GA there, they're like, okay, you can go ahead and bill the patient because you have a signed ABN on file, okay? Just a couple of things in reference to the lab and pathology section. Remember your drug screenings. That's going to be found on page 493 in your CPT. You also need to know your code ranges for blood glucose levels. I think it's 82947, 82947. That is just one of them. And then your panels. Remember your panels? That was the big thing, right? There's going to be 10 questions in lab and path. A couple of them are going to come from your panels. Understanding your panels. Those panels were listed on, where were they? Starting on page 488. 488. Remember there are panels that are included in panels. I don't want to confuse you, but the example I'm giving is, let's see, CPT code 80050, right? 80050. That is a panel within a panel example. Renal function panels. Make sure you know the CPT code for renal function panels. And then we get into surgical pathology. You're going to have a couple of questions come from that section for sure. And remember, surgical pathology started from just looking at the specimen to reviewing, to taking a biopsy, to taking like a resection, like a portion of the bone being the highest level. Remember those, right? Let's see. Autopsies, page 8. Let's see, if they're doing just an autopsy on a particular organ, for example, CPT code 88036. And if they do surgical pathology on the bone and they do what they call a decalcification process, I think that's 88311, right? And then the decalcification process, so if they say they performed this procedure 3 times on that specimen, then your decalcification process would be ×3, right? So I know you're like, why is she saying decalcification process? I have said it to you before, but you can find it on page 566, page 566. Right? So that's an add-on code, 88311. The decalcification process is an add-on code, and it's to go with your surgical pathology codes, right? The 8800 to the 88, I think it's 907, something like that. 88309. Those are your surgical pathology. Please remember those. And then urinalysis is also another common lab, and you have to identify whether it is automated or non-automated, with or without micropsy. And then they have a few definitions here on the left-hand side. Qualitative, what is present. Quantitative, how much, right? Those are 2 important terms, qualitative and quantitative. See what else we got. And your consultations in the pathology section will say exactly that. And if you look on your reference page, it will tell you, go straight to page 502. See what else we got. We spoke about anatomic pathology. Cytopathology is the study of cells. And we spoke about surgical pathology. That's level 1 all the way. 4. E&M. Let's see. Do I want to do E&M? I think I want to save E&M for, because I don't want to rush that for the boot camp. The E&M, we'll save that for next week. Yeah, that's all E&M. That's going to take some time. I cut that down really short though, and I don't want to confuse you, but we will review this next week. And I can also include medicine. I'll be going back over all of these next week anyway. Let me open up the line just to see if you guys had any questions for me. I just wanted to give you guys, like a little in-between before the actual boot camp. So I hope it was beneficial. It wasn't really something that was prepared, but I just wanted to give you two little extra sessions just to discuss what we have. Hey, Nikki. How are you?